Okay, dear friends, we'll move on to another important topic, psoriatic arthritis. Okay, very important topic, psoriatic arthritis. 15 to 25% of patients with psoriasis develops arthritis. Okay, so this is a statistics. Not all patients, 15 to 25% of patients with psoriasis can go for arthritis. Psoriasis causes spondylitis and arthritis. So, psoriatic arthritis comes under the category spondyloarthropathy. What are the other spondyloarthropathies we have read already? Ankylosing spondylitis, reactive arthritis, Crohn's disease, ulcerative colitis. These four conditions apart from psoriasis can cause spondyloarthropathy. Very important. Psoriatic arthritis can have extra-articular manifestations. Apart from joints, what are the other areas psoriatic arthritis can cause? Problem: eye, skin and mouth. So, patient can have problem in the eye, skin and mouth. Okay. Actual etiology, even in 2023, whatever book you refer, no, even though I'm telling from current books only, cause is not known. That's the truth. 50% of cases are associated with HLA-B27. This is a time on 10 lakh times repeated MCQ. Okay. That's only in 50%. Actual cause, why psoriasis patient that 15 to 25% of patients are developing arthritis, the cause is not known. Clinical features can be broadly categorized into skin lesions and arthritic features. Skin lesions, just dermatologists would have taken in detail. I'll tell you, scaly erythematous plaques. You can present a scaly erythematous plaques. Here only they would have taught you Auspitz sign. Okay. Cobnus phenomena. All those things they would have taught you. So this is scaly erythematous plaques. It can present as guttate lesion. You see, guttate in Latin means drop. Okay. Since this looks like a raindrop, it's called guttate psoriasis. So its presentation can be like this. Otherwise, it can present like lakes of pus. Small pustules will be there. They coalesce together. It forms, this is a lake of pus. Just I had compared with a lake inside. Okay, and there's a lake. This is called lake of pus appearance. So the skin manifestation can be like this. Arthritis features. Whatever, this is very important. Ortho, this is very important. It can be asymmetrical oligoarthritis or it can be symmetrical polyarthritis like rheumatoid. Mostly it will be asymmetrical. Oligo means very few joint are involved. Asymmetrical, few joint involvement. Otherwise, symmetrical, many joint involvement, polyarthritis. Common joints that are involved are knee, ankle and foot. Knee, ankle and foot. Okay. Spondylitis with or without sacroiliitis. The distal interphalangeal joint arthritis. This is a joint that characteristically involved. This is what they ask in psoriasis. Any joint can be involved, dear friends. I told you knee joint, ankle joint. I told you any can be. The characteristic joint that is involved is our distal interphalangeal joint. So you see here there is bulging. Able to see this huge bulge. So distal interphalangeal joint is characteristically involved. In extreme cases, what it has, and you see here, it causes a resorption of the bone here. I will erase it. You zoom and see, please. This area, you zoom and see. Okay. So it can cause erosion of the bone at that level. Okay. And arthritis mutilance, 1 lakh time repeated MCQ. Very severe cases when you don't treat in time. In severe form of psoriasis, arthritis in which bone resorption happens. Look at this. This is a normal size of a phalanx. Everything reduced like a frog, escargot. So this is called arthritis mutilance. Totally gone. Everything resorb. You see here the X-ray. Everything you see, total resorption of the bone. This is called arthritis mutilance. So whenever a word arthritis mutilance comes, we are dealing with a case of psoriatic arthritis. Okay, it's very important. Since it's causing terminal phalanx, very commonly involved cause sausage-shaped digit. It causes sausage-shaped digit. Whenever the word sausage-shaped digit comes, we should know, as a NEET exam lawyer, we should know 7 differential diagnoses of sausage shape. You know, sausage, see, edible, but this is sausage. And the digit swollen like that looks like a sausage. So, sausage shaped digit. Number 1, Rickets. Number 2, tuberculous dactylitis. That's called Spina ventosa. Number 3, sickle cell anemia. Number 4, outdated condition Syphilis. Number 5, Sarcoidosis. Number 6, Spondyloarthropathy. Here comes your psoriasis. Okay, here comes the psoriasis. And last but not the least, chronic osteomyelitis infection. So, 7 causes are there for sausage-shaped digit. This itself has been asked several times with various choices in our NEET. So, I had collected from all the books and there are only 7 differential diagnoses for sausage-shaped digit. We should memorize this. Okay, yes. Coming to investigation, to be very, very clear and to be very frank, there is no lab or radiological features specific for psoriatic arthritis. So, diagnosis is purely clinical. Okay, depends upon our clinical ability. Yes. Coming to treatment of psoriatic arthritis, medical treatment, if the patient presents with pain and acute inflammation, non-steroidal anti-inflammatory drugs first line, physiotherapy. The drug of choice for psoriatic arthritis is methotrexate. When it is associated with spondylitis, sulfasalazine and hydroxychloroquine. These are the 3 drugs asked question. Methotrexate is not only it's an anti-mitotic agent, anti-cancer agent. Not only that's used in rheumatoid arthritis, it's used in psoriatic arthritis also. Hydroxychloroquine, not only used in rheumatoid, it's used in psoriatic arthritis also. Sulfasalazine in ankylosing spondylitis, you will give that. The same drug, it's used in psoriatic spondyloarthropathy. So, these are the 3 drugs. Intraarticular steroids, injection, whenever it involves a major joint like your knee joint, intraarticular steroid is very helpful. Surgical management, if it is not settling down with all these medical measures, no other go. You have to go for surgical management, that is arthroscopic synovectomy, remove the synovium. In very much damaged joints, you can't do anything, replace the joint, arthroplasty. Okay, to some extent, we have completed the topic psoriatic arthritis. Thank you, dear friends.